Hi, my name is Rebecca and I am a physio or a physical therapist from Northern Ireland. I am in Ghana volunteering in a hospital for a few months with the aim of improving the overall standard of physiotherapy services in the area. I'm making this video for people that would like to help me out, or if you're just interested in hearing more. I work in Sogakope District Hospital, which is the only hospital in the Kedah area providing in or outpatient physio, meaning people could be travelling up to 2 hours for their treatment, maybe 2 or 3 times a week. Many are out of work with severe disability and have to pay a lot for transport, causing problems with attendance. The need for physio is actually well established, and we see everything from paediatric to elderly people, with a wide variety of musculoskeletal, orthopaedic, surgical and neurological problems. But as you can see, this clinic is as basic as it gets, consisting of 1 physio, 2 physio assistants, a plinth, a couple of gym balls and a few mobility aids that are probably older than me. So although the need for physio is well established, our clinic is definitely not. I know that a good physio can provide treatment with only the use of their skilled hands, and as much as I love the challenge of trying to improvise and be creative with what we've got, there's been many occasions where I've seen patients, some similar to Mr. Harrison here, who would hugely benefit from some basic equipment, such as parallel bars, a couple of mirrors, heat or ice packs, stationary bikes, electrotherapy or some simple gym equipment, and more readily available walking aids. Mr. Harrison suffered from a stroke about 7 months ago, and we have been working on regaining some of the function he has lost along the way. Unfortunately, physio only started about a month and a half to 2 months ago, and with our lack of input, Mr. Harrison had become dependent on his family and wheelchair. There are so many pieces of basic equipment he would likely benefit from, but aside from the treatment in the cubicle twice a week, we were also able to give him a slightly better walking aid to get him moving at home, but we had to travel to the nearest city, Accra, about 2.5 hours away to get it. Physio is well established in these cities, and because of the high standard of facilities, the Ghana Health Insurance are able to justify accrediting the physio services into their system. So that means that patients in those areas are able to enjoy physio without having to pay extra. However, patients like Mr. Harrison are not only receiving below standard level of services, but are also having to fund each session even though they pay for their health insurance. I've discussed my problem with the lack of insurance here to the directors and the physio at the hospital, and as you can see, they have had big plans even before I arrived to build a new, fully equipped physio department on the hospital grounds. But of course, like anything new, it takes a lot of time, organising and most importantly, money. Some new or even second-hand equipment will create a more efficient clinic, making rehab a wee bit easier on the patient and the therapist. I want to give this new department a kickstart and to provide people in this area with the same level of care they would get if they were to live elsewhere in Ghana. Hi. Hello. Hi.
You're really cute.
Hi.
Mm-hmm.